alaikum. Thank you for attending this session. My name is Dr.amaar Ai Omar. I'm a neurologist in Ibrahim bin Hamad Ubaidullah Hospital, Ras Al Khaimah, UAE. And today's talk about the Rescue Registry of Stroke Care Quality. I have nothing to disclose for this presentation. So what is the registry? Registry is a collection of information about individual, usually focus around a specific diagnosis or condition. So we are collecting information or data about these patients or individuals, but in a specific disease condition or condition. And the importance of the registry, they are most useful for appraisal of clinical effectiveness. That means how much is the clinically effective this treatment or this procedure, and for long-term effect of this treatment also. And not a small portion of population or patient, in a heterogeneous population of patients. And it's also important for the evaluation of implementation of and adherence of the clinical guidelines. You know all that guidelines are prepared and for a long time by smart people, by having a lot of expertise, but who will follow, who will adhere for these guidelines? And why not? That can be provided by the registries. And registries also provide a real-world view of a clinical practice, contributing to ongoing process of quality improvement and education. These, not all, but they are useful also for determining the presence of disparities in healthcare deliveries among subpopulations, because sometimes different areas may provide different healthcare, and the registries provide the data for that. Assess also the trends for utilization, the novel technologies and the quality of care. We are in an evolving world. We have every now and then a new technology, new devices, and some are helping in the diagnosis and the treatment and the care of the patients, and how much the registry will provide us, how much we are using these. And registry have been gaining an increasing visibility in the researches. Now, research can be done with basing on the data from these registries. On the other hand, the registry have some limitations, and the assessment or treatment criteria may be not uniform between the places that are registering. Maybe the data are not complete, and this is not uncommon, or the follow-up data. So we have a set of information that is maybe a little bit incomplete between now, center to center or patient to patient. Sometimes there is lack of data verification, solid verification, and patients sometimes are not monitored firmly as the trials. You know that when they have trials, there are very strict criteria and monitoring, not like the registry. And maybe there is no control population for the studies in that. But still, registries and stroke registry can provide us with a huge information and enabling us a high caliber research, stroke research. You know, with the stroke research, you need a good number or a high number that can be giving the valid data for the treatment, for the diagnosis, for the care of the patients. Promoting stroke center designation. So you can, with your data and the registry, identify yourself as the center who's giving more stroke care or specialized stroke care and being recognized as a stroke center. Supporting the hospital level quality improvement. We all need to improve. In a hospital care level, looking for improvement. With the registry, you can monitor this improvement by time. And it drives the creation of a regional stroke system. And this is an important because stroke management is just not an individual management. It is not a one-man show. We know that it's a system that is should be settled among the region on the governmental level, so we can direct resources into a better utilization and better outcome. So what about rescue, which is our main subject today? Rescue, which is a registry for stroke care quality. It's one of the stroke registries among the world. A lot of governments, a lot of governmental supported, a lot of countries have their registries. But rescue is having something unique about this. Rescue is an initiative of the ESO East project, which is European Stroke Organization, enhancing accelerating stroke treatment. So this is the abbreviation for the ESO East project. It's designed to help registered sites or countries to improve their stroke care system. In a simple way, this is designed to improve the healthcare system regarding stroke patients. And it's initially targeted in the Central and Eastern Europe, but Rescue extend their arms to welcome users across the world. That's why Rescue is regarded as the first global registry of stroke care. And it is also the most expanding registry maybe all over the world. The membership is free and open for hospitals, centers, clinics that treat stroke patients anywhere in the world. Up to the last of the September, of 30th of September, there is 70 countries are contributing, and these are their flags and throughout the Europe, Africa, South America, and Asia. So what is the use of Rescue? It's as a tool of continuous monitoring. It's not just to see where are you, it's a continuous monitoring and evaluation and improvement of your healthcare quality. So this will identify a specific gaps in the healthcare delivery also in a multiple level. So it's a national level, regional level, or hospital level. You know, sometimes one side has said, I'm doing very good job. But when you are doing the registry, you will find your performance, your healthcare delivery compared with the others in your region and on your national and even in the globally. Data from the Rescue also can be combined with evidence base of global best practice in acute stroke care, implementing across the countries and the hospitals. And you will see how much this with the best practice. And then it can also improve the practice. What is the impact of the Rescue? What it will provide us, these quality registration. Rescue brings new and more accurate knowledge about the stroke care in our countries. So it is knowledge, we have data, we know what is going on in our countries regarding this issue. Rescue can also provide the evidence-based targeting, what should be improved. So with the data showing sometimes that there is a problem in the dysphagia screen, and that's an evidence base that we need a program or project targeting improvement of this. Improvement also can be observed through the data are provided by the rescue each year. So it's a continuous monitoring, follow-up, and that will be provided also by the data. And also there's in collection that for the rescue is a tool that can change the quality of healthcare to the stroke patients in every hospital and in every country. The rescue have a performance measures. So to unify the stroke care among the sites that is registered, there are performance measures which are published in Stroke 2015 by Norway, and it includes the coordination of the care. So that's based in the stroke unit or a critical care area, and diagnosis with the brain imaging, vascular imaging, cardiac arrhythmia detection, therapy assessment, preservation of the neural tissue with the thrombolytic therapy, the door-to-needle time, and other measures. Prevention of complication, which mean here we are doing the dysphagia screen to prevent pneumonia. And you know that aspiration pneumonia and cardiac complication are the main cause of death in acute stroke patients. So by preventing this and by detecting this, we can improve the outcome. Also, the initiation, other measure with the performance measure, is the initiation of secondary preventions. So antiplatelets, anticoagulants, lipid-lowering agents, blood pressure lowering, carotid surgery, on the smoking cessation. All of these are for secondary prevention, are measured with the rescue registry. And last is the survival and the functional outcome. So this is the site for the rescue, and you can register your center or hospital or clinic, and then you register yourself as the data coordinator. And by this, you can put the patient information. And what is important about this, or what is interesting, what is fascinating, in fact, on this rescue registry is all the information is in one page. And you can put these information, fill it, according to the diagnosis. The questions might be different, according that is ischemic stroke or hemorrhagic stroke or TIA. And the informations are not including any names, any file numbers. So by creating a patient in the registry, it will create a unique registry number that you can save it, and you are the one who's inputting the information. You know which patient is that in your hospital. The others cannot. And it will assess different information about the rehabilitation assessment, dysphagia screen, the imaging, severity scoring, and also the treatment, whether it's thrombolysis or antiplatelets or endovascular treatment, and about atrial fibrillation detection. Other is the secondary prevention about giving the patient with the antiplatelet, statin or statins, antihypertensive, smoking cessation, and the discharge, whether discharge disposition, transfer, and what is the disability scoring and MRSA, or if there is a death. Recently, there's in the COVID area added whether the patient is tested COVID positive with stroke patients. And we found it is easier that when you are the Excel sheet registry in the hospital, and including the data that is involved here in the registry. So you have your hospital data, taking it from the patient's file, and you have this Excel sheet. Then you can fill these information instantly because you have it in hand. You don't need to go to the file and open information by information. You have all informations in hand, and you can add patient by patient, filling the information. It will not take much time, and even a few minutes. In a few minutes, you can fill the patient's information. Once you finish, you can click on Save or Mark as Complete, and you can start with another patient. And that's how to build your patient registry. There is other point that in the stroke registry, fascinating point is the report. So I give my registry, but I give the patient information, but I want to know what is these data, how can I use it? And the rescue can provide the reports. And these reports about not only your center and your hospital, but it's also about the country and the country timeline. So this is monitoring year by year or quarterly or half yearly for your hospital and for the country. And it also provides the angels aware what is the performance from the angels aware. Because the angels aware recognize the hospitals and centers with this registry. And that will provide them the parameters and the eligibility for the award. And in fact, this is what makes also the rescue registry expanding more and more, because you will be awarded for your improvement in the care quality. And these reports, fascinating. You don't need to wait. It's updated on hourly basis. Every hour you can have the updated report for the registry in your country and in your center. And you cannot, it's not only to see it on this screen, you can also download it. And by download the data, the reports, you can have the data in your hand. And this is what appears when you can download the data. You open that, you can have as a quarterly report, biannual report, or annual reports. And you can have the data as an Excel sheet, PowerPoint, or array data, whatever you want. And when you have the data in your hand, you can compare, you can provide it to your administration, you can plan your projects, your plans. That's readily accessible. And you can do also your research because you have the data in your hand. For example, this is for UAE. Now just we have the 2 centers are registering patients, and it can provide you with the median patient age. You can compare with the other center. You can see yourself within the country where you are sitting. Gender distribution, for example, door to needle time for the patient with thrombolysis. There are a lot of parameters you can take from that. And for the also the Angels Award, which is adopted now by the World Stroke Organization for the last from the last year. So it is not only for the European or for the World Stroke Organization that there are these parameters that you can follow. The your performance and your eligibility for the award, which is given every quarter, and you will see the improvement of your performance. The award will take about 10, but if the 10 parameters, 10 KPIs, key performance indicator, but 2 of them are regarding the endovascular intervention. So if it's not a center with the intervention, it will not be estimated. But if it is a center, it will be estimated. And this will be compared with your country and with all the world. This is about rescue registry. By this, I end my presentation, and I'm happy to have any questions to answer. Thank you.